Okay, so next is pain with just standing. The first thing is you want to make sure is that if you are having pain with standing, it's actually just standing. A lot of people associate pain with standing, and they'll be like, just standing, man. Like standing just really hurts. And I'm like, okay, what are you actually doing when you're standing? Are you just standing there talking to someone and they're like, like working in the kitchen, like cooking? I'm like, okay, so we're not actually just standing, it's probably like this. So there is a difference between true, pure, just standing and hurting and standing while you're working on things because that tends to be more of a load sensitivity, whereas standing straight and hurting is more of an extension sensitivity. If we've talked about it and I've told you that you have an extension sensitivity, then you probably are hurting when you're just standing still. Um, and the way that you can fix this is a couple different things. First off, we tend to, when we lock out our knees, humans like to conserve energy. So we tend to lock out our knees and just rely on all of our ligaments to hold ourselves up. And then we kind of lean back onto our heels. That creates a lot of extension in the low back, and then that can create more pain. So one simple thing you can do is just bend your knees a little bit. That's going to make your glutes kick on a little bit more. It's going to flex your hips a little bit more, and that actually tilts your pelvis a little bit. The other thing is an intentional just pelvic tilt. So you just squeeze your glutes and do a little posterior pelvic tilt, problem solved. You're standing in the grocery store like in line for 2 minutes, you do a little bit of pelvic tilt. It's a little more work, yes, but it's going to like drastically help your pain. Or if you're doing something where you know you're going to be there for a long time, like you have a standing desk, or you're working on something at a countertop or like somewhere where there's a cabinet, you can open the cabinet door and actually put your foot on a shelf so that when you bring this up, that pulls you into pelvic tilt too. Less extension, that'll create less pain. Or you can like set a stool. If you're working on something and standing, you can put a stool there and stand like this instead. You can switch feet and go back and forth every few minutes. Whatever it is, having one foot up on something is going to create slack in your hip flexors a little bit and just pull you out of extension.